Hey guys, my name is Ilana, and my case study is on peptic ulcer disease. So peptic ulcer disease also stands for PUD, and it is an ulceration or perforation in the lining of the stomach, duodenum, or esophagus. And it occurs in the lowering of the stomach, following the first few centimeters above the duodenum. And H. pylori and the use of NSAIDs, alcohol, smoking, stress, shock, and genetic factors is what typically causes PUD. And what H. pylori is it's the bacteria that lives in the digestive tract, and it penetrates the mucoid lining of the stomach. So basically it's an infection. And the common symptoms of PUD is epigastric pain and burning sensation. So in my case study, I have a 38-year-old Hispanic female. Her name is Maria Rodriguez. She's a Catholic. She does use tobacco. She's widowed and lives with her two daughters that are 12 and 14. She works as a computer programmer Monday through Friday. Her grandmother had diabetes, and her father and grandfather have peptic ulcer disease. So Maria was diagnosed with GERD 11 months ago, and this could be an indication of why she had PUD, because GERD includes impaired swallowing, aspiration of gastric contents into the lungs, ulcerations, and perforation of the esophagus. She also experiences symptoms of hematemesis, which is vomiting of blood, vomiting, and diarrhea that led her to be admitted for a GI workup. She then ended up getting a gastrostomy to treat her duodenal ulcers with generalized gastritis and positive biopsy for H. pylori. So in the case study, we did get her diet intake. Her typical breakfast consisted of 1 slice dry toast. On the weekends, she ended up eating more, because she would cook for more people. So she would eat an omelet, rice, pozole, pancakes, waffles, and fruit. Her typical lunch was a sandwich from home, and that was turkey, whole wheat bread, and mustard with a piece of fruit and 2 or 3 Chips Ahoy cookies. Her dinner was 2 cups of rice, 2 to 3 ounces of any type of meat, 1 cup of fresh vegetables, and that was either like tomatoes, peppers, or onions. Her beverage intake for a day was 8 to 10 cups of coffee and 1 to 2 soft drinks daily. She has no known food allergies or intolerances. She isn't taking any vitamin or mineral supplements. Her and her 2 daughters self-prepare the food and purchase the food at home. Whenever she was admitted to the hospital, she was NPO, and she was receiving Pivot 1.5 continuous drip. So Maria weighs 110, her head is 5'2", and her BMI is 20.2, which is a healthy weight. So as you can see, she does have a lot of abnormal labs, but it wasn't anything too crazy because of her diagnosis. And she did experience a lot of symptoms like her hematemesis, which is the vomiting of blood, her diarrhea, her nausea, her GI upset, which could potentially all lead to some malabsorption symptoms. So like for instance, her protein was low in the beginning, because that could be due to her GI upset, or it could be due to her H. pylori, because with H. pylori, that causes stomach acid to inhibit proper digestion of proteins. Her glucose was also high, and that could just be because of the tube feeding. And then on the right, we see that her CBC count, and we also see kind of some abnormalities there too. And that could just be because, she underwent a lot of bleeding, so you're going to see some abnormalities there. And her white blood cell count is also high because of inflammation from the H. pylori. So on her physical exam, she only had a few abnormalities, and that was her skin. It was warm and dry to touch. It was that could be because she had a temperature of 99 degrees, and it could be dry because she did intake a lot of coffee that causes dehydration, as well as hematemesis also causes dehydration. She also showed rapid breath sounds, which could result from the duodenal ulcers, and her abdomen was tender with guarding because they are inflamed organs within the abdomen. And in her chart, it showed that she had absent bowel sounds, and I think this is why the doctors said she was almost ready for solid foods. So these are PES statements. The first one was increased nutrient needs related to altered GI function as evidenced by diagnosis of PUD, altered nutrition-related lab values, duodenal ulcers, hematemesis, and gastritis. So I put the first one because all of the symptoms that she's experiencing result in weight loss or nutrient-impaired oral intake, so it's really important to increase her nutrient needs based on her status. The second one that I put was food and nutrition-related knowledge deficit related to lack of education or understanding of the details of caffeine restriction for an ulcer disease patient as evidenced by interview and daily dietary intake. And this was because the patient didn't realize that coffee was such a big factor in PUD, and she did tell me that she was willing to change, so that's why I put that one. So my goals for Maria is to support the medical treatment that she's on now, which is NPO, until further authorized, and then maintain or improve nutritional status, so developing a dietary lifestyle that would sustain her, and then minimizing any symptoms of PUD with foods recommended and foods restricted for PUD that I'll talk about later. So nutrition intervention plan, I put patient is able to maintain or regain optimal weight status. Again, it's because the symptoms that she's experiencing can result in potentially malabsorption and weight loss, so we want to make sure that she's at her appropriate weight status. And then I put patient is able to show improved food choices by next visit. That's in the interview, I was going to give her a pamphlet with foods recommended and foods restricted for PUD, so just making sure that she knows the difference between the two and what would benefit her in the long run. And then I put patient decreases the amount of coffee to 3 to 4 cups, because in the interview she did agree that she would decrease her coffee intake. That would essentially help her PUD a lot. So for monitoring and eval, again, in the interview, she agreed that she would write down in a diet journal. So I would see her in 4 weeks, and this journal will just help me evaluate what kind of food she needs to increase or decrease, and it would also help me see if she's experiencing any symptoms of PUD. And I would just monitor her weight status for this. And I would also like to do a serum testing just to see if there's any changing in the hematological indices. And for PUD nutrition, there's really no data indicating that diet is a causative factor for PUD, but there's ways that we can prevent PUD from occurring, or try to prevent PUD from occurring. And this is by eating 2 hours before laying down, eating smaller, more frequent meals. Foods to avoid is black and red pepper, caffeine, coffee, alcohol, milk, and cream. Restricting acidic foods is only recommended if the individual cannot tolerate them at all. And then foods recommended is non-cola carbonated beverages, herbal teas, skim milk, 1%, buttermilk, low-fat yogurt, poached hard egg, hard-cooked or scrambled eggs, all ready-to-eat cereals, baked, roasted, boiled, grilled, stewed meats, low-fat cottage cheeses, peanut butter, all except fried potatoes, rice, pasta, all fruits and vegetables, fat tolerated within current dietary guidelines, and all except high-fat or fried desserts, and all except pepper. And this about does it for my case study. Thank you so much.